Hello everybody, we're at the ASBMR conference. We just met, we're two nurses and we like to exchange our thoughts and experiences. And Solange just won an award. Congratulations.
Thank you.
And maybe you could introduce yourself and tell us a bit about the award.
Okay. My name is Solange Benardo. I am from Australia, in Melbourne. I received the award of Betsy Love MCCLung. It's award that support nurses for further studies on the knowledge on osteoporosis field. So it's very, very important for us nurses to be acknowledged on this way because we believe that it's a field that needs a lot of more nurses to close the gap of
Absolutely.
the treatment.
And
yes.
we agree on that.
Yes.
So I'm a Dutch nurse, and we found out by just talking together that we share so much of the same challenges in the Netherlands. A lot of the things are the same.
Yes.
And I was so surprised, pleasantly surprised, to find out that this big conference, international conference, was opening with a nurse.
Yes.
And
Yes.
an award. So very
Yeah.
nice.
Yeah.
So, how do you give care to the osteoporosis and the fracture patients?
Okay. So I am a fracture liaison nurse back in Australia, as I said. I see patients in the hospital, I assess patients that are coming with minimal trauma fractures, 65 years old and above, or 55 years old and above as well. We started with 65 years old, but we increasingly seeing patients coming 50, 60 years, 55 years with those kind of minimal trauma fractures. So we're trying to decrease the age as well so that we can give opportunity to those patients as well to see someone and explain to them about osteoporosis as earlier as possible. So I see these patients in wards when they're coming with fractures. I educate them on osteoporosis, importance of treatment, vitamin D, calcium intake, and also direct them on a path to take after the hospital. That's just one part of what I do. The second part is I see patients, I coordinate the falls and fracture clinic in the hospital. There's a part of Australian Institute of Musculoskeletal Science. AIMS, we cut it for short. We have the falls and fracture clinic where I see these patients that I've seen in a hospital. They come back as a follow-up. We see them in falls and fracture clinic, but also the GPs or general practitioners in the community that refer their patients in falls and fracture clinic. We see now falls and fracture clinic is a multidisciplinary clinic where we have myself as a nurse, we have exercise physiologists that is assessing gait and balance and assessing falls risks. We have the bone densitometrist that we do the bone density as well as body composition where we look at the fat and muscles. We also have the geriatrician, which is Professor Gustavo Duque we work with. Does the medical assessment, and sometimes we implement treatment for osteoporosis. Sometimes when we can't implement treatment for osteoporosis at the time, we do another follow-up with this patient depending on the reason why we did not implement the treatment for osteoporosis at that moment. So that's a second part of the work I do. The third part is the hip fracture registry, where we collect data of every patient that are coming to the hospital with hip fracture. So it's a registry that is between Australia and New Zealand, and we collect data, and it helps us to improve the care of a hip fracture patient in the hospital. And also I present that data quarterly to the multidisciplinary team in the hospital so that we can see where we're doing good, where we need improvement for our hip fracture patient. Yeah.
And what are the challenges you're facing?
The challenges, well, there's quite a lot of challenges at the moment in the sense that the awareness the need of a fracture liaison nurse in a general population. I would just say doctors, patients, as well as in the community, to close the gap of secondary fracture. It's important that we have a fracture liaison who follows up with the patient from the time they come to the hospital to the time they leave. And sometimes there's those follow-ups that they need to come to the clinic or to their GP even to do the treatment for osteoporosis.
Well, what would happen if there wasn't a nurse?
Most of the time, the patients are lost between the gap. From the time they leave the hospital to the time they go home, most of the information are lost on the way. I'll give you one example. When the patient are discharged from the hospital with a recommendation of dental checkup before starting on osteoporosis treatment, who does follow up this patient that needs a dental checkup and then start on medication for osteoporosis?
Yeah.
No one does that.
So they get lost.
They get lost. Sometimes the GP doesn't follow up with that patient to have their dental checkup and to start them with osteoporosis. I'm not saying all GPs are bad. I'm not saying anything like that. But there are a lot of cases that I have seen that 6 months has passed and the patient has not started on any treatment of osteoporosis after our hip fracture.
So the nurse are kind of gluing everything together.
Yes.
Oh, yes.
Yes, I'll say that.
Yeah.
Yes.
And what does the patient notice when nursing is involved in the treatments?
They are more free to ask questions. They have that trust between the healthcare professional and the treatment that they're receiving. Because if they don't understand, they know where to go to ask questions. While if there is no one there, no nurse involved, when they leave the hospital, if they call back, they can't trace the doctors that have been treating them. Even if they call the ward where they were, they can't find proper information.
No.
But once they have a point of reference that they can always call to ask information or ask questions, they feel more comfortable. They feel secure, I would say.
And they have a place to go to or somewhere to phone.
To phone, yes. So I have a lot of phone calls from patients or family members, and as well as doctors in the community, if there is something they need to follow up for their patients as well.
Yes, yes. So I think that's the experience of the Dutch nurses also. Yes, they were gluing it together.
Yes, yes. I think that the closing the gap, it's really important that nurses are there for it. I don't see any other person that is or profession that is capable to do that because of the nurse's relationship with their patient.
Yes.
I think we have a special relationship with the patient.
I think we
say.
do. And just the nursing has the right competencies to address all kinds of problems and help with all kinds of questions the patients have.
Yes, that's very true. That's very true. And also the patients, they feel really comfortable to talk to nurses, comparing to doctors, because especially we're dealing with older patients. They probably they grew up in ages that you don't ask questions from your doctors. So
that's something I recognize.
Yeah, so they feel more comfortable talking to nurses. Yeah.
And how many osteoporosis or fracture liaison nurses are there in Australia? Do you know? Are there a lot of you?
No, there are not a lot of us. Those I know, not personally, but I have heard the hospital that they have fracture liaison in Australia, maybe about 5 or 6 places, only that I know. There could be more. There could be more, but I am not aware.
No.
But for those who are doing all the care, they're very, very few.
Okay.
No, very few.
That's a shame, isn't it?
It
Yes.
is. It is a
Well,
shame.
in the Netherlands, we also have osteoporosis nurses. Not so many, but I think most of the hospitals have one,
Yeah.
and that makes it a very individual job, a very
Yes.
solo job.
Yes.
So
yes.
it's nice to talk to another osteoporosis nurse.
Yes.
And
Well,
I think we should collaborate more.
we should. We should. I think we have few osteoporosis nurses, but fracture liaison is different from osteoporosis nurses. However, even with osteoporosis nurses, I don't know if they have that community of osteoporosis nurses. If they do, I'm not aware of. I would love to be to
Yes.
be a part of it.
We face the same
We
challenges.
face the same challenges everywhere. With the fracture liaison, the plan is one hospital, one fracture liaison for one hospital.
Yeah.
That's the plan. However, I'm not sure when that's going to be implemented. So, fingers crossed.
Fingers crossed.
That is not
Yes.
going to take forever.
No.
We need nurses.
We need a lot of people to hear this.
Yes.
Yes.
We need nurses in this profession, in this field. We need a lot of nurses. The general population are growing older, so the challenges are increasing.
Yes.
So there is a lot of fractures happening.
And how do fracture liaison nurses get their knowledge?
It's something that is on the way. However, it was a training. For example, in my case, I have worked with orthogeriatric for more than 10 years as a specialist nurse in orthogeriatrics. And then I had a training with Professor Gustavo Duque in fracture liaison services, because he had implemented one before the one I am working on in Sydney, and then he came to implement another one in Melbourne. In Sydney, it works perfectly. I haven't had a chance to visit, but we had a conference where I've seen them presenting the data, and it was really beautiful. So, and he came implement in Melbourne, where I've been trained under him. So I hope will be a training for more fracture liaison nurses in Australia, so we can have many of us doing this job.
That will be good.
Yes, yes.
We in the Netherlands also lack a bit of training, but I think we have a little bit more than you. But well, it's difficult because there's just a few nurses, so it's difficult to organize schooling and training. Yes.
Yeah. I think it's something that the governments also need to look into. Yeah, because if we're looking at it in a small scale, we won't be able to achieve big things.
That's right.
Yeah, we need the body, government body, to look into it, because we know the burden of osteoporosis in the healthcare system. It's a huge.
It's huge.
So if we have a lot of hands on it, us nurses will be really happy.
Do you have some special case, some special patients in your mind that you think that's a case that really explains?
Yes, I had a patient that when she came in the hospital in 2016, I saw her with fractured clavicle, and we talked about osteoporosis. I educated her and her daughter on osteoporosis, and I also spoke to the treating team about starting on some kind of looking into osteoporosis treatment. How unfortunately that patient was discharged home with vitamin D alone. No treatment of osteoporosis was implemented. 8 months after, the patient came back with a femur fracture, and then by then they started her on denosumab. 2 months after discharge, 2 months after, she came back with a hip fracture. and this patient unfortunately could not be discharged home anymore. She deteriorated so much, and she was put into a nursing home, but her condition was not very good. I do not think she would have survived for another 6 months. So that's that's one of the reasons why I think it's important to think ahead when we see minimal trauma fractures, even as simple as wrist fracture. We know that the next fracture could be a hip fracture. So,
true. Yes, it's an awful story.
Yes.
But it's really what keeps us going, doesn't it?
Yes, that's.
What would be when would your dream be coming true? What would you wish for?
I wish for more training for nurses in the field of osteoporosis. I wish more awareness on the disease itself to patients in the community, general practitioners, doctors in the hospital, so that it will not be a single hand work, but a team effort.
And
multidisciplinary team effort for the treatment of osteoporosis, because it's really a burden in the society. Yeah. That would be a dream come true for me.
Well, I can relate to that. I agree. Yes. Let's hope that your dream comes true. Yeah.
Yes.
Well, your award and everything you did for it, that's a good start.
It is a good start.
Yeah. And it would be really nice to exchange more.
The challenges for nurses, I think, is almost the same everywhere. Nurses is a professional that is appreciated, undervaluated as well. We have a lot to offer. But we have very little opportunity, and we need more opportunity.
To be the glue.
Yes. Yes.
So next year, in 2020, then it's the 200th birthday of Florence Nightingale. Maybe it would be a good year to put the nurses on
a map.
Would that be nice?
Yes, it would be nice.
Yeah. Well, I hope you have a great conference here. This is just the first day today, and well, we'll talk again.
Yes. No problem.
Thank you very much.
Thank you